some meal times between 20 to 30 minutes. Don't give up. सारे दिन में अगर हम इतना काम करते हैं and we can't keep some hour for ourselves for eating food, तो उतना काम करके फायदा क्या है? This then creates a. He was one person who was so lazy that he used to do everything on the bed, and today he is running 3 gyms. This lady was a school teacher, and we have one teacher here. Yeah, we have a teacher here too. She was a school teacher. For the first time in a school, we would have heard that the teacher, the students in the school used to change classrooms so that she used to teach them. And that's rarely unheard of, you know. But this lady was around 120, 130, 140 kgs. She was never able to sleep for more than 3 to 4 hours in the night. The life change that has come up. And here we have with us one of my very close friends, Bela, please. So feel free to speak to her. A transitional journey also, a transformational journey also for her. One person who has guided and changed the life of thousands of patients till date. Thank you, Bill. So friends, this was a short talk on how we have to take care of ourselves post bariatric surgery. Life can be great, life can be brilliant. But you know, there are various other aspects of this too. And various other aspects are कि जब मोटापा आता है तो बहुत सारे मेडिकल प्रॉब्लम्स लाता है, फिजिकल प्रॉब्लम्स लाता है. But along with it, you know, there are times when our confidence goes down because some skin issues come up, some hair issues come up, and certain cosmetic issues also come up. So every time when we do a support group meeting, not only do we tell our patients about what are the ideal things that we need to do, but we also bring one resource person, one knowledge person to guide you. How can you make your life more beautiful, more energetic, more lively, and how can you live your life more fully from henceforth? So Ria, please, thank you so much, friends, for coming here today. Now we'll be having with us the next speaker, and I would like Ria to introduce her.
Thank you, Dr. Manish, for an insightful talk. I hope this was an eye-opener for every one of us about what grade of obesity you are in and what is the treatment plan for each of the grades. Now there's another important aspect which we always miss, that is how obesity is affecting the skin and hair as well. So I would like to call Dr. Mahek Motwani, who is a gynecologist and skin and hair specialist. She will give a talk on how obesity affects the skin and hair and what are the various treatment plans for that. Big round of applause for Dr. Mahek Motwani.
Hello, good afternoon. Thank you, Ria and Sneha, for inviting me today here. Pleasure to be here with all of you today on this Sunday afternoon. So, as you know, Dr. Motwani just spoke that obesity is associated with many problems, medical issues, then physical issues, as well as psychosocial issues like less confidence, less productivity. But one concern what we have seen in our cosmetic clinics, we get lots of patients, those who are suffering from obesity with skin and hair problems. Today, I'm here, I'm Dr. Motwani, I'm a skin specialist from Pink Dot and Protein Medispa. Today, I will be addressing this important issue, how obesity affects your skin and hair, and what are the regular plans or medical plans, as well as what are the advanced treatments now available with us. So now today we can see there are a group of people who are struggling with obesity. I can see group of people who are recovering from the obesity, that is they are in the journey of weight loss, and also I can see group of people who have already recovered from the obesity. So there are lots of, today I will be addressing more on like how obesity causes the skin problem and how you can keep your skin glowing, radiant, and some hair issues as well. So there are lots of problems because of obesity which happen to the skin as well as to the hair. Yes, skin pigmentation is one of the major problem with which is associated with the obesity. Then there are other problems like obese people we have seen having lots of dull and dehydrated skin. Then Sebaceous glands, ओबेसिटी में बहुत फैट होने के वजह से जो अपने sebaceous glands होते हैं, the glands which produce oil get blocked, and so they have tendency of oily skin and acne. Then they also suffer from excessive sweating. Because of excessive sweating, there is lots of moisture clog, मतलब जो sweat है वो clog हो जाता है in their abdominal folds, in the underarms and like groins, perineal area, all other areas, जिसके वजह से रेड पैचेस आते हैं, उनको फंगल इन्फेक्शंस का बहुत like problem होता है, as well as they have erythema, they have bad odor coming from them. So these are lots of, they suffer from lots of medical problems due to the obesity. So coming to the very very important problem, just skin pigmentation. Skin pigmentation is a thing we get lots and lots of patients coming. Now what is this skin pigmentation? Skin pigmentation is actually a dark patches on the back of the neck, elbow, knees, underarms, and in the abdominal folds. So why obese people have these pigmentations? What happens? The obese people have lots of fat in their body and also insulin resistance. Insulin resistance means that the body insulin is not working properly, जिसके वजह से अपनी जो पैनक्रियाज इंसुलिन बनाती है वो बहुत ज़्यादा इंसुलिन बनाती है, और ये ज़्यादा इंसुलिन के वजह से क्या होता है कि अपने जो बॉडी के सेल्स हैं बहुत ज़्यादा रैपिडली ग्रो होते हैं, बहुत ज़्यादा रैपिड रेट में फॉर्म होते हैं, और सेल्स में क्या होता है, मेलानिन पिगमेंट. व्हाट इज मेलानिन पिगमेंट? इट इज़ a pigment which gives a color to our skin. So this melanin pigment is in excess in certain areas of the body, and they give these dark patches or the pigmentation, especially on the back of neck, elbows, knee joints, and underarms. These in our medical language are called as, this situation is called as acanthosis nigricans. So now what are the treatments for this pigmentation which has occurred due to the obesity? Friends, I would like to say reducing weight itself is a treatment for reducing or lightening this pigmentation. So obesity, when you lose your weight to a certain extent itself, the pigment gets lightened. But there are lots of treatments for this thing. You can try these home remedies. You can see I have put down few of the home remedies. You can do cucumber and lemon juice paste and apply it. Then honey, yogurt and turmeric paste, as well as aloe vera and milk paste. These home remedies you can do yourself, and they lighten your pigmentation to a certain extent. It is not only for dark patches as well as for your skin. These home remedies are quite good. Then there are other line of treatments, that is medical line of treatments. So we prescribe lot of creams, gels containing lactic acid, glycolic acid, retinoin. Then we also prescribe antibiotic creams, antifungal agents, antimicrobial soaps for the skin infections. Then there is one group of medicines called as retinoids. So it can be given in the form of like pills as well as a local application. These medical treatments basically lighten your pigment up to a particular extent, but those who are having the stubborn pigmentation, which the medical treatment can't take care of, there are lots of advanced treatment available with us at the Pink Door. So these are uh, chemical peels. Now what are chemical peels? Chemical peels are basically a fruit peels which exfoliate your upper layer of the skin and give that newer, fresher skin and lighten your pigmentation. The other modality of treatment is microdermabrasion. So microdermabrasion is in the form of diamond polishing and crystal polishing, with which we remove the dead skin, and then this treatment basically lightens your pigmentation. Then we have lasers. Coming to lasers, at Pink Door we have US FDA approved technology PicoSure laser, which targets that stubborn melanin pigment, breaks it and lightens the skin tone. Then there are other lasers with us, that is CO2 laser, which not only lightens the pigment, also makes your skin look smoother and radiant. There are other modalities of newer treatments now available. These are in the form of IV and oral medication. So super antioxidant like glutathione, then vitamin C, and many more like Trenexa. There are lots of supplements available with which you can lighten your pigment. Like they break the melanin or they block the melanin formation deep inside. So you can see these are the treatment done with the Picosure laser to reduce the skin pigmentation. You can see this video. This is our client who was suffering from pigmentation. You can see on the face and see the post pigmentation picture. Okay. Now let's come to some one more problem obese people suffer, especially females. Those who are obese females, they basically suffer with the growth of facial hair on the skin. Now, the excess fat in obese people secrete a hormone called as androgen. Androgen क्या होता है? These are male hormones. Testosterone सुना होगा आपने. So testosterone is secreted in these females in a very high amount. ज़्यादा testosterone होने के वजह से there is rapid growth of hair on the face, जिसके वजह से they feel very odd like in the moving in the public and all those places. So, what are the treatment for these things? Basically, again, reducing weight itself stops the rapid growth of this facial hair on the face. बट जो अभी बाल आ गए हैं उसको हम लोग कम नहीं कर सकते हैं विथ एनी मोडालिटी ऑफ मेडिकल ट्रीटमेंट. सो वी बेसिकली ट्रीट दिस पेशेंट्स विथ reducing or correcting their hormonal imbalance by giving them non-hormonal medications, then hormonal medications जैसे spironolactone है, OC pills है. All this basically help correcting their hormonal imbalance. But cosmetically also they need to be treated. Cosmetically we have to basically they do shaving, waxing, but उनका भी कैसे they are also having lots of side effects, like they are painful, then they give you ingrown hairs, they give you pigmentation, and again it is a same cycle going on. So now a newer modality of treatment is come, that is a laser. So there are lots of lasers available, but at our window we have a very high in advanced US FDA approved technology diode triple wavelength, which basically targets the follicular pigment and damages the follicle. जैसे root होता है और उसका plant होता है, root को ही damage कर देता है. But it requires around 10 to 12 sessions to get rid of this and get good hair reduction or facial hair reduction around, I can say 80 to 90% is a permanent hair reduction. So you're off that shaving, erasing and everything. Again friends, now it's for all the crowd. I would like to say ki, of course, diet plays very important role in making your skin look radiant, glowing, as well as water consumption. These two things are very important to keep your skin radiant and glowing. But today I would like to just tell you how to keep your skin glowing forever, just following a simple skin routine. So in the morning, I will just tell you how, what you should apply in the morning, afternoon, and in the night. So how you go about it is for everybody, males or females. It's exactly same for everything. It's nothing कि male मैं नहीं use करूँगा and female. So everybody loves to have a good, glowing, and radiant skin, or at least a clear skin, right? So morning, definitely you should cleanse your face with a good cleanser. Then apply your serum. So lots of serums available what we apply. You can go for vitamin C, you can go for hyaluronic. There are lots of serum available. Then you apply your moisturizer and then your sunscreen. In the afternoon, you should follow just a moisturizer and a sunscreen. In the night, just before going to a bed, again we prescribe like according to the concern of a person. Again, hydrating serums, or like those who are above 30, 35, they can go for anti-aging serums. That like we prescribe retinol, then Bellucin. There are lots of anti-agings also available, and then you can apply your moisturizer. If you just follow this basic Skin routine, yes, you will have your skin glowing ever, as well as I said, lots consumption of water and a good healthy diet definitely helps. Just a small information. I just want you should take one mantra of keeping your skin glowing and undamaged. Always use a sunscreen. Sunscreen is a very important ingredient you should incorporate in your application in your daily to daily life, because sunscreen basically prevents your skin to get damaged by the UV rays. When you're sitting here, this light also is damaging your skin. You are in front of screen, whenever you're in front of mobile, that time also your skin is getting damaged. In your younger age, your collagen is getting remodeled and resynthesized very fast. So lots of skin problems are very less in the younger. बट एज यू एज आपको अचानक से ऐसे लगता है अरे मुझे तो पिगमेंटेशन नहीं था अभी आ गया, मैं तो कुछ नहीं करती हूँ, मैं तो कुछ नहीं लगाती हूँ. It's just probably because you are not using the sunscreen. So sunscreen is very important. It also prevents premature aging. So always apply sunscreen at least 2 to 3 times a day, and especially whenever you are going out 20 minutes before that. So it's very important to apply sunscreen and keep your skin radiant, glowing. So be healthy and be glamorous. Thank you. Neither.
Thank you, Dr. Mahek, for such an insightful talk in skin and hair. Anyone who wishes to connect, for pigmentation, post surgery as well. Once you start losing weight, you also want to, look good as well. Go out, dress up well, go in the social outings as well. So you can definitely connect at Pingro Clinic or Protein Med Spa for getting, good again, skin pigmentation or facial hair, whatever you have. This also, boosts your confidence as well, and also it will kickstart your weight loss journey in a very beautiful way. So thank you, Dr. Man.
Yeah, Dr. Mahek said she is there for half an hour after the event if anyone wants to speak to her.
Yeah, I'm there.
So she will be there for half an hour after the event. Anyone who wants to speak with her, they can consult her as well.
First of all, let me compliment Dr. Motwani for an excellent presentation. I have some questions. What is the youngest patient you have operated and what is the eldest patient you have operated? Number two, are there any complications? You showed the different types of bypass. Are there any complications? And number three, I think after every successful person, there is a story. As I understand, you are a pediatric surgeon. How did you enter into this field of pediatric surgery?
Okay. So the first question was the age group that I operate. So it is not the age group that I operate. It is bariatric surgery, as I said, is a science. Can you please close that door over there? Thank you so much. So bariatric surgery is a science, and we go purely on the basis of protocols. We operate right from a 9-year-old to a 77-year-old is the highest that we've operated. Second, sir, please go through my visiting card. Sir को एक दे दीजिएगा. I am not a pediatric surgeon. I am a bariatric surgeon. I am purely a weight loss surgeon, and not now. It is since past 23 years that we've been doing only bariatric surgery. And third, you are talking about whether what are the complications that we can see. So, friends, there are certain complications which are written in the books. Whether a patient can have some leakage sometimes, whether the patient can have bleeding sometimes, but these are not just related to bariatric surgery. Any surgery on the stomach or intestines can cause leak. Any surgery in any part of the body can cause bleeding. But what happens in bariatric surgery is a different story altogether. There is not so much of technology which is utilized in many other surgeries. Bariatric surgery is a surgery where we don't compromise even 0.01% on technology, expertise, experience. And what happens in the bargain is since there is no compromise, दो बुक्स सजेस्ट सर कोई प्रॉब्लम नहीं, इधर आ जाइए, अंदर बैठ आ जाइए, नो प्रॉब्लम, आ जाइए प्लीज आ जाइए. So though books suggest that there can be certain percentage of patients who can have complications, to be telling you frankly, over past 2 decades, we have rarely seen any problem or complication happening. But at the same time, I would like to tell you something about Astha Bariatrics. Astha Bariatrics is a COE. It is a center of excellence in metabolic and bariatric surgery. There are only 2 centers of excellence in Mumbai. There are only 10 centers of excellence in India. We are a very high volume center. We are the highest volume center in Mumbai, almost the third highest volume center in the country. So though because of the experience, expertise and the type of equipment and Astha Bariatrics being a bariatric surgery center, standalone bariatric surgery center, you might not find complications coming in our patients, but we have the experience of treating more than 500 to 1000 patients who have been referred from various parts of the country and outside the country too, where there might be those 1 surgery a month or 2 surgeries a month centers जहाँ पे इतना experience नहीं होता है. So we've had experience in treating leaks, we've had experience in treating bleeding cases, we've had experience in treating various other things. But at Astha Bariatrics, everything is protocol based. 1 के बाद 2, 2 के बाद 3, 3 के बाद 4 and 4 के बाद 5. No skipping of steps. And if there is a patient, so we don't use, apart from the best equipments, we don't use anything else. So if the patient comes and tells to compromise, chalo thoda jaldi kar lo, ya skip your steps and skip the protocols, but get it done. So we say go next door. So I don't mind operating 10 patients lesser a month, but आपकी जान और हमारी नाक हमें दोनों प्यारी है. So that is the reason no compromise anywhere, and you will never have a compromise in results also. And we also have with us, where is our iconic person, Sarla. I just saw Sarla. Kidhar? Arey, khade rahiye. She's Sarla again, like Bela, she's come here. So Sarla is again one person, Sarla Thakkar, who is responsible for helping thousands of patients get operated. So Bela and Sarla have been. So अगर किसी पेशेंट को कभी ऐसे होता है कि मुझे ऑपरेट करना है, करूं या नहीं करूं, तो सरला, बेला and such, we've got at least 100 more people like this who are die hard, means they will do anything and everything to ensure that what benefits they have got, they should not, they want to help others get that benefit. So they are there with us. जितना भी बात करना है आप बाद में इनसे बात करिए, and you will feel that you are a different person altogether. Thank you, Sarla. Yeah. Depends on the type of surgery. Depends on type of surgery. And say if I'm.
I would just like to say I have one of my cousins who is she's from Gujarat and she got it operated over there. And basically she's fine. But after the surgery, her hemoglobin goes down to practically 7, 6. So she has to take some injections, for regaining her hemoglobin and all. So that's what, that is what we found out in her case. Of course, it depends from doctor to doctor and surgeon.
No, I would never blame any doctor, because remember one thing, that any and every doctor in the world would only like to see his or her patient doing well. So I would not blame anyone, but
Because we have seen this example in our family, so that is the reason I want to ask that are there any chances?
I'll tell you. So I would not blame that surgeon. I will not even blame Gujarat for that. but one of the most important things, and this is what मैं दिल खोल के बोल सकता हूँ. So most of us bariatric surgeons always feel that bariatric surgery is the biggest surgery. We are the big surgeons. According to me, my team is bigger than me, and we have some stalwarts with us. We have got some extraordinary nutritionists who are working with us, who ensure that they follow up with the patients in such a manner that, because the patient who has got operated now has to understand that he is now supposed to have more of quality diet than quantity diet. And when you are going to have quality diet, and if you follow, it is not that आपको यही 5 चीजें खानी है या 2000 चीजें नहीं खानी है. Out of 1000 things that you are eating, only 5 you would be said no, but right, 995 you can have. But understand that you are now going to concentrate more on quality diet and less on quantity diet. When you're going to be concentrating more on quality diet, then listen to them, get their experience. They are there to help you, assist you. Now there is what the thing matters. This hospital, now you can see all these pretty girls over here. We have got a team of 14 people over here in the department of diet. who are hell bent on ensuring that you are trained well to ensure you do diet well. And after that, we just don't operate and leave. We keep investigating you third month, 6 months, 12 months, and then once in a year to ensure अगर कहाँ पे कभी विटामिन या प्रोटीन या कुछ कम होता है तो वी कैन गिव सप्लीमेंट्स बट फॉर डिपेंडिंग ऑन सर्जरीज it depends whether you require supplements or you don't require supplements. If you're doing a basic sleeve, you might not require so many supplements. If you're doing a bypass where there is malabsorption, you might require supplements. So it's a mix and match. But since this team is more knowledgeable, when you come to the center, hand yourself to the nutritionist and to the surgeon. Right now, we are in a position to get you the best, possibly at least 20% more than what you can do for yourself. So before the surgery, ask 5,000 questions. We are there willing to take care of every query. But after surgery, आँख बंद करके फॉलो करिए जो आपको कहेंगे, because we are the only people who are there to ensure that you will have a very good quality of life for years and years and years to come. Yes.
Because you're going on the general anesthesia, have you had anybody that is
General anesthesia, contrary to what you think, is the safest sort of anesthesia. Safest means your entire body is in the control of the anesthetist. And we have a team of anesthetists with us, and head by Dr. Bhavesh Nanda, who's probably given maximum anesthesia to obese patients, right from 80 kg patient who should be 50 to 417 kg patient. Not once or twice, hundreds of times. So we have got that kind of a level of people with us, where be rest assured that till the time you are not fit or optimally fit for surgery, we won't take you up. We are not in a hurry. जहां आपने ओबेसिटी को 10 साल सहन किया है, वहां पे 2 हफ्ता और सहन करो और अपने आप को फिट करो, फिर ऑपरेट करो. So we are not in a hurry. No loans or EMIs on my head that I am in a hurry to operate patients. I am very clear in my concept that आपकी जान और मेरी नाक दोनों बहुत प्यारी है, दोनों को बचाने के लिए सब कुछ करेंगे. ठीक है? Yeah, sir. Yes. So depending again on lifestyle, I got your answer question. He says that are there chances of weight regain? So it also depends on surgeries. And you know, at certain age, there are certain surgeries that we can do. For certain phases, there are certain surgeries we can do. For example, a surgery like a sleeve gastrectomy has got a 1 to 4% chance of weight regain. A surgery like mini gastric bypass and bypass have a chance of around 1 to 1.8% of weight regain. है तो है, but suppose I get an unmarried girl to me and she says that she wants to get operated, I will operate only a sleeve gastrectomy irrespective of knowing whether weight regain हो सकता है, because I am more concerned about her pregnancy, marriage, physical relation, growing the child, which becomes difficult with a mini gastric bypass and gastric bypass. In fact, so many times bariatric surgery is a treatment for infertility. So depending on the stage, on the grade of the patient, evaluating the patient, we decide what is that patient ideal for. After that, there are sometimes patient, if I say that we want to operate a bypass, but patient says, no, I don't want to get operated for a bypass. So we tell them that, okay, ठीक है, we'll go for a lower surgery. But till date, all across the world, 70% surgeries are sleeves, which is the safest and best sort of treatment. But depending again from patient to patient, we decide whether we want to go for the higher surgeries or still the lower surgeries. So friends,
One more question. What is the approximate cost?
that is individual talk.
And is it covered under Medicare?
Yes, so if you fall under the guidelines set down by IRDA, in today's date, we operate at least 30 to 40 patients under Mediclaim. At the same time, there are 10 to 15 or 20 patients who don't get Mediclaim. So it depends on criteria of the patient, all as per your height, weight, BMI, your course, existing medical problems, your type of insurance, your period of insurance, many things matter. But then for that also there are solutions. If you are not under BMI category or you still have to get operated, then there are EMI systems, there are multiple other systems which are there.
After this session, we will get a chance to speak regarding case to case.
Yes.
We will have the question now itself. It's not general question.
Huh.
As you know, my wife is being operated.
Yeah. So we will have a separate one-to-one.
Because out of 2-3 things,
Yeah, we will have a one-to-one talk. So anyone who wants to see, so we will possibly end this session by 1:30 because we have got a session by Dr. Vidhi now, trying to explain you what type of activities we should carry on or can carry on post bariatric surgery to keep yourself fit. And post that we are there till 2:30 in this center itself. Anyone who wants to ask one-to-one questions, there will be a lot of people who are here there to support you and assist you in this. So या बोला ना बाद में बात करेंगे.
पॉकेट होएगा नहीं है.
So Riya,
कैसे मैं इधर इधर लगा सकती हूँ आप.
So we have this Q&A session and first one-to-one consultation with Dr.
Riya.
Manish after the session. Now I am called Dr. Vidhi Villani. She is a senior physiotherapist at ASTA and she has been practicing since 25 years in musculoskeletal rehabilitation and post-operative rehabilitation as well in pain management.
ठीक है.
So post-surgery, one more thing which is an important aspect that is exercise. So with nutrition, exercise is also very important to help you achieve that perfect weight loss and also toning of your body. So now I like to call Dr. Vidhi Villani, who will speak like post-surgery, what kind of exercises you should do and how to do it.
Yeah, चलेगा. That's fine. So good afternoon everybody. थोड़ी हलचल चालू है. Everybody tired of sitting? You all can just get up on your seats. Just stand up and sit again. So थोड़ा relax हो जाओगे. हाँ करवाऊंगी. मैं इसके लिए ही आई हूँ. So I'm a rehab person, तो मुझे मेरा पहला वही है. इसलिए तो बोला हलचल. Okay, बैठ सकते हैं. So relax everybody. I have my colleague with me, Dr. Himali, who will be assisting me and helping me. So we had a lovely insight by Dr. Manish of what the bariatric surgery is about and why we enter this phase of obesity. So he gave us various stages of obesity and when does the surgical stage come. Of course, pre-bariatric or in the lesser grades of the obesity, you all have various things and one of the things is exercise. I will not be speaking about that. I will just be speaking about the post-bariatric rehab formulas. So, see, immediately after bariatric, everybody is like, अरे बाप रे, वापस exercise ही करना पड़ेगा. So everybody is again in that fear. पहले भी exercise बोला, अभी भी exercise बोलते हैं, but guys just relax. So it is not going to be a tedious exercise. But of course, as you lose weight, you realize that your muscles are getting a little flabby, or maybe the tone is not, really so nice and firm to give you a better look. So you can go in for some kind of an aesthetic or a better looking body when you, of course, you do some toning exercises. So I'm here just to show you what kind of toning exercises you can do on your own just by a single guidance. So even if we show you, probably you can try doing it on your own. And if you're still not so sure, you can take help or seek a physio's assistance and they will show you how to do. So there are various things of how you manage these toning exercises. So one of the things is resistance bands, which we have here. Another thing is we use weights, so dumbbells, ankle weights. Then there are some functional exercises where you use your own body weight as resistance to do certain exercises like push-ups, sit-ups. I'm just giving you examples. I will not make you do that, so don't worry. And of course, there are various aqua exercises that have come into the picture lately. You all must have heard of it, which are very enjoyable also. So, but I cannot show you all that. So I will just be showing you simple TheraBand exercises. If we have two bands, if anybody from the crowd also wants to come here and do it along with me, please most welcome. So I'll be giving one band to my assistant. She'll be showing you as I verbally say, you want to come in? Please most welcome. Aye. I'm so happy. Somebody volunteered. So yeah, there are various colors and bands. They are up to the resistance grades. The least grade comes in yellow colors and the highest grade comes in gold. So we have grades as yellow, red, green, blue, jumping on to brown, black. They are the basic ones, but different companies have their own color routines.
So whenever you go to buy a band, you should always start with a medium resistance one. The low resistance are generally for pediatric uses. So you can use the basic medium ones and then slowly jump to the higher ones. So in the medium also you will have 3 different colors. In the high you'll have some 4 different colors and things like that. Okay, so they are resistance bands, so they help you to tone your muscles, gain some strength in your body. So post-bariatric, when you see your body and your muscles are getting distoned, they are not really toned well, like you have loose, flabby muscles and skin and a weak body. You can help yourself to strengthen those. मसल की स्ट्रेंथ बढ़ाने अंकल बराबर समझे so अच्छा so I'll give you one and she'll take one आंटी थोड़ा ये करेंगे थोड़ा आप करो हाँ ठीक है so we'll begin with the here also I won't be able to show you everything but whatever in standing I can show you I'll definitely be fair enough to show you all those. So the first we'll begin for our elbows under the for our elbows. So under the foot and then bending for the biceps. Yeah, you can just put chalega. Keep your foot flat. Keep your foot flat and just bend your elbows and straighten it. So I'll show you once and then you can do that one. Yes. So don't move your elbows from place. Very easy, isn't it? And you like also to do it to show some good that you have nice power in yourself. Right? So it's very simple. You can do one at a time and you can do both together as she is doing. Similarly, we can do it for our triceps, the tricep strength. So I'll show you how do you do that. So you can hold both the bands in your hand like this, with a small distance between them, shoulder distance. And for the triceps, we'll go down. This is one way of doing triceps. So you must be hearing of people saying, "मैंने आज biceps किया, मैंने आज triceps किया in the gym." The same things can be done by you with very simple methods at home and very safe methods. So therabands are very safe as compared to the dead weights that we take. Dead weights sometimes cause a lot of stress on your joints, which then cause a lot of joint pain and joint issues. So we prefer more of bands where there is a complete stretch on your muscle. All the muscle fibers are ensured of acting in that regime. So there's another way of doing triceps is the overhead tricep. So you hold it like this and you just pull up. So you must be seeing people holding dumbbells and doing this. Very simple ways. I'll show you. I'll show you. I was coming to that. So just let me finish with the shoulders and the arms. I can show you that. There is something that we do for the shoulders. Shoulders which cause the shoulder weakness, which causes a lot of issues of the neck and of the shoulder as such. You all must have heard of the commonest thing, frozen shoulders, muscle tears.
I was just about to ask you what about the frozen
So all these things should be avoided and they can be avoided when your shoulder is in a good shape. So shoulder controls a lot of our activities. Major activities of women is on the shoulders. पूरा भार अपने कंधों पे लेते हैं. Whether it is mind or it is physical. So you need to strengthen your shoulders. It comes on top of the list for every woman, I feel. So the simplest ways, this is for your shoulder flexion. You go it straight. That's for one angle. This is for the other angle. You take it up sideways. Full, जितना आप जा सकते हो. आपका जितना resistance. ठीक है? That is a low grade one. This is a high grade one.
This helps for the frozen shoulder.
This helps for the frozen shoulder as well.
They have frozen
They can do it. Still do it. Maybe with a lesser resistance and a lesser range. They won't be able to go overhead, but you can do it with whatever range available. All right. So these were the two things. The other things for the shoulders will be holding it forward and stretching it outwards. So just take it to whatever level you can. Easy. So this is very good for your breast toning as well. It helps a lot for the toning of all your anterior chest muscles as well. And there's another one that you go behind your back and you pull it in the front. Yeah. Again, it's very good for the breast as well as your shoulders. You have another one is taking it out and pulling it in.
This is really good.
This is really good. See, she's experiencing and she's enjoying it already. And anybody more, they want to come and experience it, they are most welcome. So again, this is again for the shoulders, our adductors, our adductions. Again, very good for the breast toning.
Another one is you just go overhead, go up straight, and come in again. Easy, very simple, and very effective. You can feel it already? Thing. आंटी आप करेंगे? हाँ, आप कौन सा करेंगे? पीछे वाला? इजी. तो आगे की तरफ पुश कर सकते हैं आप. यहाँ पे ही रखिए और यहाँ से आगे की तरफ पुश करेंगे. यस. तो आराम से, झटके से नहीं, थोड़ा पीछे पकड़ के, तो रेजिस्टेंस मिलेगा. थोड़ा पीछे पकड़ के. यस. Yeah, so you can just pull it in the front. Yeah. Easy? Very good. Nice. We have one more exercise for the shoulders again. This is very important in frozen shoulders. Who wanted to know? Very, very important in frozen shoulders. This is maximally restricted in those cases. You can try doing this exercise. Very simple, just opening and closing. Okay. And what else can we do is extensions. You want to try? She's my friend Ansha. She's also. You can do it in once. Sorry? You'll get it at any sports shop. You get it on Amazon as well. Sorry? Brand, there are many brands available. So you can see, Visco is good. So I've been using Visco. Those are tubes. Yes, that can also be used. They are tubes with handles. You get different varieties. You can use any. You can try and test. Yeah. Pulling it inwards. Pulling it inwards as well as pulling it outwards. Both of them. All right. So we. I just showed everything for the arms. Yes, yes. Sorry? Yes. They're basically for muscle toning. So strength बढ़ेगा तो tone होगा, correct? So obviously everything will help. All that I showed, the biceps, the triceps, the shoulders, everything. Let me come on to the lower body. I'm still stuck onto the upper one. Easy, so madam. Straight. You can try it, ma'am. This is easy. It depends on how you hold it also. Okay, so it's first green and then blue. Blue is a little harder than green.
Depend on colors.
Yes.
And length also.
No, nothing. The length of how you hold. Length of how you hold is
Shorter.
That's okay. It depends on how you hold it. The distance between your hands.
There's a technique.
Yeah. There is of course a technique in knowing and understanding it. You need to learn it and then do it.
So everybody can do that.
It's not very costly. You get a set of 5 different colors and about say I think just 1500-1600. They're not costly. They're very cheap. You can buy and upgrade your resistance accordingly. Yeah. So as I said, the least resistance is yellow and the highest resistance is gold. So you first begin with some medium strength. The medium strength ones are green, blue and red. And all the others are higher strength. And the silver and gold are the highest strength. So they are used by sports people, not for us. I've not been carrying anything. Concession चाहिए लेने के लिए ऐसा.
Concession for what?
Terabens.
But they are free. They are not cost. They are not going to cost you. They are all free.
Now Manish is planning to keep it for all bariatric patients, post-bariatrics.
For all doctors, it's free to use it.
अभी एक मनीष bariatric करो, Terabens free.
If all these patients after bariatric surgery promise me that they will use this regularly, I don't mind giving one. I can give two also to everyone.
दोनों सेट्स मिल जाएंगे और क्या चाहिए?
But promise that you all will use it. Because your health is our primary concern.
We see after surgery.
After surgery only.
She wants to
Yeah,
Individual questions you can ask.
later on. Okay, so I'll show something for the lower part of the body also.
we would like to
I think whoever is coming is just enjoying doing it. So for the lower part, sitting में एक chair मिलेगा.
just stand for
Yeah, just push it in the front. Yeah, just push it in the front. Sorry.
know that we are
So you will have to learn it from a physio for at least 1 or 2 sessions, and that is how they will tell you then.
okay. If it is
Take a training, just like how you take a training from some for your
no means our muscles is pulling means we are doing it.
muscles will pull in any way, but
Patients for some time, yeah.
so sit at the figure of 8.
Can everyone see
Figure of
this?
8. Figure of 8. Figure of 8.
There are some exercises that we are showing for the lower body.
छोड़ ये
If
छोड़.
you all can't see, आप यहाँ पे आगे आके जवाब भी हो जाएगी चलेगा.
No, she will stand also. Let's take something. हाँ, क्रॉस बांधना है ताकि वो स्लिप नहीं हुए.
Can we take her here in the center?
Yeah.
Now is this better?
So for the lower part, we first begin with the knee exercise. So she is going to just lift her knee. I've tied it in the figure of 8 for both her legs. So one will be working statically for the hamstrings and one is working statically for the quadriceps, basically for the thighs. Okay, so this is one way of doing it. And the second way of, yeah, so you can do the other leg also and show them. It's very simple, just tie it in a figure of 8 and just pull your legs one at a time. The other way of doing it, you take both of them up in the air, दोनों साथ में, and एक को आप नीचे की तरफ खींचेंगे. So your other side, the back side of the thighs are working then. So both the groups of the muscles are working. Other than these, there are exercises for the hips. So we'll show you those as well. Standing, ऐसे ही रहना, उसको ऐसे ही रहना. This was for the thigh muscles, yeah. So we show you something for the core, your abdomen. I think everybody is always worried कि ये कैसे कम होगा. So you stand at this side so that you can see. So one way is taking each leg sideways. So she still has it tight, and she's going to move each leg sideways using the side core muscles. Correct? Very easy, very simple. Working it on both the sides. Similarly, you can do it forwards and backwards. So your core muscles all over. So this is behind, working your glutes. No, no. Right from bachas to. I didn't want to say that.
So this will be definitely very useful post surgery.
Post surgery, yes.
Yeah.
So as I said,
To
each and
strengthen your
every
muscles post-surgery.
muscle, yes, yes. Each and every muscle. In fact, there are many muscles. कर सकते हैं, but my main motive is to show what is important post surgery. And also forward. She'll show you how to take it forwards also. So again. They are very simple to do. So, you know, the whole set of exercises can be completed in just 20 minutes. Sorry. So yoga has its own importance. It plays more emphasis on stretches and on asanas, flexibility. When you go on to from yoga to power yoga, it of course helps you to use your own body weight as resistance and do toning. And this is just an additional prop to make you do anytime. Most welcome. So, और बताना है? You want to show the squats? Yes. हाँ. उनको करना है. So she can do the squats. So we can even do squats with this. Very well done. She is volunteering for that. So she will show it to you for the adductors, for some more exercises for the thighs and the. You can just tie it on this loop.
2 minutes.
Oh, ठीक है, sure. Or you can tie it around here also and with the loop. Next time I'll see that. Next time I'll print that also. So you have to just, yeah, be away from each other so that the muscles are kept stable or thoda, or thoda separate. So you keep them stable and then you do the squat. So we know we are not, because it also maintains your stability. इधर उधर हिलेगा नहीं and वो stable रख के हम करते हैं तो the same चीज we even keep a ball and we do so we know we are stable enough.
By practice afterwards, it does not require. You can be stable.
No, you can still use it because it is acting as a resistance for your abductors, no? For your abductors, it's acting as a resistance and then you're doing. So you're stabilizing your abductors and then doing it. Yeah, yeah. So,
For the surgery, but right now my shoulders are very painful. So for that,
We have these individual questions separately. Dr. Vidhi is there for with us for some time. Let us show her demonstrations, and after that, she'll be there with us for another half an hour. If anyone has got any specific questions, you all can definitely come and ask her. So don't worry.
yeah. So there were some with the therabands that I thought. Other than that, I just want to teach you one very simple exercise, a push-up exercise, which helps to stabilize not only your core but also your arms and your thigh muscles in a very good way. And it is done in a very easy manner if you do it on a chair or a table. So for example, if this is a table, all you have to do, and you can do it in office, home, kitchen, platform, everywhere. So you can just hold your chair or your table, yeah, and just push yourself forwards and backwards. Something stable, huh? This is movable. So you can use a wall or you can use your platforms and just do that. So exercise is something which can be done any time of the day. So you don't need to really, kitchen में खड़े खड़े भी आप कुछ कर सकते हो. That also becomes an exercise for you. Okay, so I think that's all for today. Thank you very much. Yeah.
so all the operated patients who tell me that they don't know what to do, exercise is very hard, they don't have time to do. I think we got a clear demo that this can be done at home as well, and very easy, very simple. Just using some of the bands and resistance bands, and you can do so many exercises of your legs, your upper body, your thighs, and everything. So I want this time that you guys are doing the exercises and the patients who want to go opt for the surgery. So there are in the form of exercises which you could do post surgery because of being overweight, because of being obese. You feel that how could I do
Sorry.
gym exercises or something. So I hope this was an insightful session for all of you. And thank you, Dr. Vidhi Gilani, to
Please come here. Thank you so much, Vidhi. And I hope this session was a nice session and you all have liked it. These type of support group meetings are going to continue. Sorry, I have intervened. I would also like to thank Dr. Mehak for giving us a lovely talk on how to make people more beautiful. So surgery तो आपका वजन कम करती है, आपका कॉन्फिडेंस बढ़ाती है, and नई जान लाती है. But to make yourself more beautiful, to make yourself more